Bismillah ar-Rahman ar-Rahim. Today I will speak about an important issue or some important clinical definitions which are relevant to clinical practice and they might be confused with each other if not properly identified, if not properly defined and understood. And these are what is the difference between a disease and a syndrome and a medical condition and disorder. What are the differences between these medical or clinical terms? First, let's speak about what is a disease. A disease is a pathophysiologic response to internal or external factors resulting in an abnormal health state. So the disease has a specific cause and distinctive clinical presentations or distinctive clinical features or characteristic symptoms and signs. So if it has a specific cause and the characteristic symptoms and signs, this is a disease. A syndrome, on the other hand, is any collection of traits or distinctive features that run together. Because, by definition, syndrome is a Greek term. Syn means together, and drome means to run. So syndrome means to run together. That is a collection or constellation of some clinical features which appear together, and this collection of symptoms and signs or features, they might be variable from individual patient to another individual patient. So the syndrome has variable presentations and in fact has variable pathophysiologic or underlying mechanisms. If variable presentations and variable pathobiologic or pathophysiologic mechanisms which are not clearly understood. So this is a syndrome. That's why a syndrome is more or less more a wide spectrum than a disease. And a syndrome might be due to, in most of the cases, they are related to genetic factors or might also be related to non-genetic factors. And we have a very a wide range of medical syndromes like Down syndrome, like Marfan syndrome, like Cushing syndrome, like Klinefelter syndrome, and also it can be applied to what sometimes we call it diseases like diabetes is a syndrome and not a real disease because it has a very wide range of clinical presentations with variable symptoms and signs among diabetic individuals, and also with extremely variable pathophysiologic mechanisms underlying the pathogenesis of the diabetic syndrome among different individuals who are suffering from this syndrome, diabetes. Also, migraine might also be a syndrome. Epilepsy is a syndrome. It has variable causes. It has variable presentations. It has variable underlying pathophysiologic or pathobiologic mechanisms. So the range is very wide for the presentation and for the pathophysiology. So this is rather a syndrome and not a disease. So the examples of syndromes are variable, and they might be the real nomination of the conditions which call them diseases. As I mentioned, diabetes is a syndrome, hypertension is a syndrome, migraine is a syndrome, epilepsy is a syndrome, in addition to the other examples of the genetic syndromes which I mentioned, and they are very, very wide in clinical medicine, as we know. So this is the syndrome. And as regards the disorder, it means any disturbance or any irregularity or any interruption or disruption of normal or regular functions or structure of the body or part of the body that is an organ or a system of the body. When this part of the body is disturbed or interrupted or gets an irregularity, we call this a disorder, a medical disorder. For example, palpitations is not a disease, it is a disorder. It is a disorder of cardiac rhythm and or rate. But ischemic heart disease is a disease, and the underlying cause is specific, and the presentation is with a characteristic symptoms which are or basically or typically chest pain. The ischemic heart disease or coronary heart disease is a disease, but the palpitations, which might be one of its presenting features, is a disorder. It is a disorder of the cardiac rhythm, which is one of the normal cardiac functions. So when the rhythm is disturbed or gets irregular, this is called a disorder, and a disorder may be part of the disease or the syndrome. So this is the definition of the disorder. And then the number 4 is, what is a medical condition? So I mentioned disease, I mentioned what is syndrome, I mentioned what's a disorder, and then we come to what's a medical condition. When we say that this person is suffering from so and so medical condition is rather vague medical or clinical term, and it is non-specific and covers a wide range of abnormal states of health. So it is an abnormal state of health due to some response to abnormal disturbance in the internal functions of the body, and the medical condition might arise from external or internal factors, or extrinsic and intrinsic factors, which might be modifiable or non-modifiable. So any abnormal state of health related to abnormality or irregularity in the regular or normal body functions, this is called a medical condition. So this is the differences between a disease, a syndrome, a disorder, and a medical condition. And by the way, disorders can be classified into many areas, like it can be mental, it can be physical, it can be structural, it can be emotional, it can be behavioral, it can be genetic. So these are all disorders: structural, mental, emotional, behavioral, genetic, physical. These are the areas of disorders which might be part of the clinical disease or syndrome. So by this, I think it must be clear to the clinicians what is the difference between disease, syndrome, condition, and disorder. Thank you so much, and later on I will talk about another important clinical misconception or a disorder, and other clinical challenges, and the other poorly understood clinical terms. Thank you so much. Have a safe, peaceful life, and I hope for all of you a great day. Thank you so much.